Good day, everyone. This is Laura Bonilla with JBS International. Thank you for joining us today. The Substance Abuse and Mental Health Services Administration Center for Substance Abuse Treatments Division of State and Community Assistance is convening a webinar series for providers to give an overview of the Substance Abuse Prevention and Treatment Block Grant, or SABG. This series covers fiscal and programmatic requirements of the block grant. This session is being recorded for future use, so your participation is your consent to be recorded. Due to the high number of participants calling in, all participant lines will be muted for the duration of the session. If you have any comments or questions for the presenters, please submit them to me by selecting Host or State TA in the drop-down menu in your chat window. To open your chat window, please click on the chat icon at the upper right side of your WebEx window. I will read your questions to the presenters during the question and answer period. CSAT Performance Partnership Grant State Project Officers, or SPOs, will be resources and provide clarification during the session and address follow-up questions following the session. If you have questions about block grant practices in your state, please contact your state agency. With that, I'd like to introduce today's presenter, Rick Nance, Deputy Director of Business and Fiscal Operations for Illinois' Division of Alcoholism and Substance Abuse. Rick, I'll hand it over to you.
Okay, thank you very much, and welcome to the session. Today we're going to be covering the substance abuse and treatment block grant requirements, and specifically the area of fiscal and financial requirements. Today's session will cover the SABG fiscal requirements with regards to funding, SABG funding bases, the SABG set-aside funds, the maintenance of effort requirements, single state audit and subrecipient monitoring, and restrictions on SABG expenditures. The block grants are mandated by Congress to provide funds for technical assistance to each of the 50 states, the District of Columbia, Puerto Rico, the U.S. Virgin Islands, and the 6 Pacific jurisdictions. The Red Lake Band of the Chippewa Indians is also a SABG recipient. The block grant funding bases are determined in terms of they apply, each state applies for a non-competitive grant. There's a formula that looks at population and other factors to develop a formula to allocate the block grants to each state. So each state gets a block grant allocation annually as they apply. States then establish their own basis for how they're going to allocate those block grant funds to providers, any intermediary pass-through agencies that are consistent with the SAMHSA statutory requirements in the priority populations that we'll talk about as a part of that funding. SABG set-aside and maintenance of effort requirements also influence the allocation of those funds within each state in terms of how they allocate those funds out. So what are the SABG set-aside funds? Well, the funds were set aside as a certain percentage for certain services and populations to assure that certain activities are carried out as a part of this SABG funding. There's a primary prevention set aside, and then there's for states that have a population density for HIV, they have an HIV set aside if they're a designated, what's called a designated state. So they will have those. Under the primary prevention set-aside, a state must expend at least 20% of their SABG funds on primary prevention. They must carry out activities to reduce the risk of substance abuse among individuals who do not meet the requirements for being in treatment, so they need prevention services. They cannot use the primary prevention set-aside for early intervention funds. You may, however, use other SABG funds, the ones that you for treatment or other services, and the remaining portion of that for early intervention activities. Primary prevention set-aside funds can be used for the various strategies as appropriate for each of the target groups. for information dissemination, education, alternative activities, problem identification and referral, or community-based processes where you're getting information and getting prevention activities out into the community, or some kind of other environmental strategies. Those are the activities and the strategies that are allowed to be used for that 20%. HIV set-aside requirements for a state who has been seen as a designated state who has more than 10 HIV cases per 100,000 determined by the Center for Disease Control, they then have to use at least 5% of the SABG funds, and usually it is earmarked so that you have to use that amount for the SABG funds for HIV and early intervention services, for outreach and testing, for mostly for pre and post test, HIV/AIDS counseling, for the actual testing itself, and other follow-up therapeutic measures for those who in fact test positive, so follow-up sessions, high-risk assessments, risky behavior, training, those kinds of things. SABG maintenance of effort requirements relate to the amount of the purpose or the amount of money that a state is contributing and has contributed for substance use disorder treatment. The SABG maintenance of effort requirements are there to incentivize states to maintain their overall expenditures over a period of time for specific services and populations, specifically for statewide substance use disorder services, but more so importantly also for special services for pregnant women and women with dependent children. Currently, the MOE requirements are there to make sure that the stability of the state's contribution to those services stay consistent over time, and they're there to look at the issue of supplementing or supplanting state funds in terms of how, we want to supplement, or otherwise, as it states here, consists of adding federal funds to what's available. So we want to supplement the current state funds that are there. You cannot supplant, meaning to take and put the block grant money in and take out state or federal or local monies as a result of using block grant money. So the block grant monies are there to supplement the system. There are now two SABG MOE requirements. One is the SABG state maintenance of effort. So under Section 96-134, it talks more in details about the maintenance of effort regarding state expenditures for the SABG block grant. And then also there's an SABG women's maintenance of effort under 96-124. It talks about special funding that goes to programs who serve pregnant women and women with dependent children. There was a change recently back in December with the 21st Century Cures Act. It had, with the block grant regulations, had HIV and TB MOEs in it. That was recently removed as a requirement. The state single agency is the entity who must maintain those state expenditures for authorized activities at an amount no less than the average for the preceding 2 state fiscal years. So that single state authority is the principal agency. They have to assure that those state monies are spent for authorized activities, including planning, carrying out evaluation activities for prevention and for substance use disorders. An example of how a state that meets an MOE requirement is that, for example, in state fiscal, in this example, in state fiscal 2011, there was $10 million spent. In state fiscal year 12, there was $11 million. And in 13, there was $12 million. So if you average state fiscal year 11 and 12, the maintenance of effort requirement is $10,500,000. And you can see that by this, that they were over, by approximately 14%. So, and then the same holds true then for 14, state fiscal year 14. You look at the amount between state fiscal year 12 and 13 that they spent in state expenditures. You average those, get $11,500,000, and so they spent 13, so they were 13% over. So you're always averaging from the 2 years prior to the year for which you're reporting. What is the substance abuse block grant women's maintenance of effort requirement? Well, it's compared to a base in spending in 1994 was the base year for the program. When there was a survey of all the programs, and each state had to say how much they were spending, and they have to demonstrate then that the current state fiscal year spending on women's services is at least equal to the base year of expenditures. And so state and substance abuse block grants that flow through, so in this one you can use both state money and federal SABG money to meet that requirement. An example of determining that was in federal year, fiscal year, for example, here in 92 was a base year, they spent $1 million. Then in 93, they spent, the previous year they had spent $1 million, but total block grant was $10 million. They had to do at least 5%. They had to add on to that another 5% to the base year in 92. So it became $1.5 million in 94 when the base year was established. They had the previous year and then another 5% that year. So the base year in 1994 was set at $2 million. So that is now set for this state in this example at $2 million of funding that must be spent or directed towards programs that serve pregnant women and women with children. So what services are required as a part of that funding that receive the SABG set-aside funds for special services for pregnant women and women with dependent children? Well, the state must ensure that the programs are funded out of that set-aside, out of the monies, either state or federal, and they have to also show that those monies are paying for primary medical care or including prenatal care or a linkage to that service. They have to either provide the service or have linkage to it. They have primary medical, pediatric care, immunizations, women's services, or gender-specific substance use disorder and other treatment. So they have to assure that those services are provided either directly by them or by linkage agreement, but that the individual clients and their children have access. There must also be therapeutic interventions for children in the custody of women. This is an area that you need to, providers at the local level need to pay attention to, because a lot of times this becomes kind of a weaker area at the local service level. You have to have child care also while women are receiving services, and you have to have access to that, and you have to have sufficient case management and transportation to assure that women and their children can access any and all other services that they need. So they have to receive that, they must ensure that all the programs that receive this set-aside, they also need to treat the entire family as a unit. So it isn't just that you're treating individuals, you're treating the entire family. They also have to assure that the MOE funds that are being used are as payment of last resort. What this means is that if you have other TANF monies, or you have other Title 20 monies, or other local state funds from local health boards, you know, and that are there by statute, county, city, state funding, that money has to be used if it's available first, then you go to the block grant. And it's only for those clients who have no other financial means for obtaining the services. So you have to have some degree of income eligibility monitoring and checking. So what are some of the stuff with regards to single state audit and subrecipient monitoring? Okay, if we look at what's the intent of 2 CFR 200, which is the federal regulations for the uniform cost requirements and principles for audits for federal and state single state audit reporting. It prescribes how conditions under which non-federal entities, so that would be state, county, local, non-for-profits, in terms of how they are to account for the monies that are coming through and from federal funds. That they have to have a single audit and a program-specific audit. Some of the specific requirements for 2 CFR 200 for the single state audit is that non-federal entities that are over $750,000 and more in federal expenditures during that year must have a single audit. Now that means that if you're at the local level, if you're getting monies from any state or federal group coming through that are federal funds, if you combine all that together, if it's over $750,000, you must have a single audit. If you do not meet that requirement, you can elect to have a program-specific audit if the expenditures are under one of the federal programs or the federal program does not require a single audit. But generally, it's if you're $750,000, you have to do that. If you're less than $750,000 in federal awards during the entity's fiscal year, you're exempt from the federal audit requirements for that year, but you must retain records that support your expenditures, and you have to have those records available for review by any audit by the federal agency, a pass-through agency, the state general accounting office, and that means that those pass-through entities are used oftentimes around the country as non-federal entities that receive federal funds and then pass that portion on to the subrecipients to carry out some kind of federal program. So the pass-through agency has the right to look at those records and to review those as well. The specific requirements for subrecipient monitoring are, in terms of requires pass-through entities to tell each subrecipient of a federal award with specific information regarding the catalog of federal and domestic assistance, title number, the award name and number for that year, and the award year. This is often, you'll see it in a lot of contracts, the acronym of CFDA number, and that's the catalog of federal and domestic assistance. That's the award number and then the award year. And each federal year runs not necessarily consistent with state fiscal years. They run from October through the end of September. And if you're talking about other awards, you need to notice on the notice of award what the beginning and end date of other federal funds are, because those are the dates, and we'll talk in a little bit about some of the specifics that are kind of important with regards to knowing this information about what CFDA you're getting money from and what the federal year is. The subrecipient monitoring requirements convey requirements for federal laws and regulations for the provision of the contracts in any supplement. So you have to pass those along to the pass-through entity, and the pass-through entities have to pass, they convey that on to those that they give the award funds to. So all of the requirements for the federal block grant are given to the state, but those requirements are also passed down to pass-through agencies and entities, and also to other local provider contracts and entities, and that they all must comply with the block grant requirements. Some of the requirements are that also that the state or the pass-through entity have to monitor recipients or to monitor subrecipients to ensure that the federal awards are being used for those authorized activities, and that those activities are in compliance with the laws, the regulations, and the provision of the contracts and the grant agreements that are set out, and that performance goals are being monitored, and that they're being measured against the contract, but also against the expectations and the goals of the block grant funds that were given. Subrecipients, as the little drop box here shows, are those people that are non-federal entities that expend the federal funds. So it can be either, a pass-through entity, or it could be someone who's being given the money to pass the money out or to do the services at the local level. What are the restrictions on some of the funds? The funds can't always be spent on whatever you want to. I mean, there are certain requirements with regards to these funds in terms of prohibited expenditures within the regulations. For example, providing for hospital services except under certain conditions that are outlined in the regulations is prohibited by the substance abuse block grant. Now, we've also included on the site specific things for the mental health block grant that are also, for those states that also have mental health block grants, that are also prohibited under that column as well. You cannot make cash payments to intended recipients of health services. You cannot use the money to purchase or improve any land or to purchase or construct capital, permanent improvement in buildings, other facilities like capital improvement projects. You cannot use it for that. You cannot use it to purchase major medical equipment. You can't use it to satisfy requirements of expenditure of other non-federal or condition for the receipt of other federal funds. So we've been asked at times like, well, can I use block grant money to serve as a match for another federal award? No, you can't. You provide financial assistance to any entity other than a public or private or a not-profit entity. So any for-profit companies have to be using state funds, but they cannot use SABG funds. Provide individuals with hypodermic needles or syringes. You cannot use it for that. Expend more than the amount of the block grant funds expended in federal fiscal year 91 for treatment provided in a penal or correctional institution. You cannot use it for that, but a lot of people, don't even know how much they spent in fiscal year 91 for treatment for those services. So, I would just recommend people just to stay away from it if they don't have the documentation to support that. But it's prohibited to be used in penal institutions unless you have that documentation. Salary limitation is, there is a salary limitation stated in the statutes that states that states and subrecipients cannot use the block grant to pay salaries in excess of level 1 of the federal senior executive service pay scale. Right now, it's no more than $207,800 in state fiscal year 17, so you cannot use it for salaries at that amount. What are some other additional kind of provider responsibilities? There are some additional pieces that we have with regards to going through. The first thing is that providers must adhere to 2 CFR 200 requirements, and they have to be able to track and report expenditures for treatment and prevention services separately. So at both the local level as well as at the state level, you need to be able to track your expenditures and to be able to say that these were treatment costs over here, and then here was the prevention services, and they have to be able to be separated within your financial reporting as well as your service reporting. But specifically for this discussion, you have to be able to separate those costs and those expenditures between the two areas, between treatment and prevention. You have to also be able to identify and separate monies for services or being paid to programs that are serving pregnant women and women with children. So you have to be able to identify which are the designated programs. You have to be able to know, if you have a designated pregnant women and women with children program, how much money is going to pay for those services at that site. If you are a designated state and you're doing HIV testing and counseling, you have to be able to sort out the costs that you're paying for staff or for the tests or supplies or those activities related to counseling and outreach for HIV testing and counseling. You have to be able to, move those out and be able to put those over here in this bucket and be able to support that with backup documentation. The other thing is that you have to be able to support your costs and to differentiate your costs by service dates and expenditure date consistent with the federal block grant years. You need to know that you have this CFDA, you have this amount of money, and you have for this grant fiscal year. Those dates kind of govern for what expenditure you can bill the state for as well as use those monies for. Because each federal grant has a start date and an end date, and the SABG funds have up to 2 years to spend the money, but you cannot start expending money that are using certain funds before the start of that grant. From an audit perspective, you have to be able to know then for the expenses which federal year is being paid or you're costing it to, and you have to be able to know then, okay, that those expenditure dates and the service dates are consistent with the federal grant funds for which you're given. So of the funded activities, there's other activities that you can, in fact, pay for other systems improvement or development activities. Once you talk with your federal project officer for your block grant and talk to them and kind of come to an agreement about, well, we want to spend some of the block grant to do, a trial program with outreach to peer-to-peer services for youth or for some other dual diagnosis programs. So, but you can use systems development to do that, to train people on how to use Medicaid entitlement programs, those kinds of things. But I encourage you to talk with your project officer prior to that time because, it oftentimes is one where you have to negotiate and say, okay, this falls in line with the goals of the SABG, but also it has to fall in line with the goals for your state. So, that's a discussion that needs to take place in order to do that. I covered a lot of material in a quick fashion here. I know we've got some time, plenty of time left for questions. So I open it up for questions now, or if I need to go back over any of the slides, I'm willing to go back and we'll go over them.
All right, so we have received one question. What happens if a state is required to expend 5% of the SABG on HIV services, but is not able to expend the full 5%?
Okay, my understanding is that they have to talk with SAMHSA about that with their project officer. And I guess this would be if they would be a designated state, that'd be the 5%. So they would have to talk with them about what would be the result of doing that in terms of, do they not draw the money down? Do they get a penalty? That I would defer to SAMHSA as to, or to CSAT, I mean, as to what the actual result of the action that would take place.
Okay, if any of the SPOs want to go ahead and chime in for this question, I have unmuted your line.
Hi, this is Cherie McMahon. Sorry I was talking and I thought everyone could hear me. Rick, you captured it nicely. That's absolutely right. What they would have to do is to contact their state project officer. And we've had some instances where this has occurred, and there's certain factors that we look at a state-by-state basis to determine what the appropriate action would be for that state. And I think you listed, what some of the possible actions would be, like perhaps a corrective action plan, or in some instances there's even been repayment. But those are things that we would sit down with the state staff and kind of hammer out.
Right. I would also add, thanks, Cherie. You kind of triggered a thought here that I didn't cover, but we should just make note of for the maintenance of effort for state expenditures. If you fail to meet the maintenance of effort, you need to clearly have ongoing discussions with your project officer, because if in the regulations there is a potential penalty that could come, you can request a waiver under the regulations if you meet certain conditions, and the regulations spell out what those conditions are. But those have to be documented in a letter to your SPO, and then CSAT will review those, and whatever action has to be taken for that. But it isn't just that, well, if you fall short, that people are just going to ignore it and you're just not in compliance. No, the not being in compliance should be taken seriously, and you must review that with your SPO. Even if you anticipate being running short, you still should talk to the SPO.
Hey, Rick, this is Larry. There was another question that had come in, and Teresa, feel free to chime in on the heels of our conversation with the state this morning. But we just wanted you to kind of make a distinction between subrecipient and vendor, if you could kind of walk through that again.
Mm-hmm. Well, to me, a subrecipient could be, you know, someone coming in and you have an intermediary agency and they then get the money for it, and then the subrecipient, who would be like a local county or a board or a local authority that covers multiple counties, and then they then contract with a vendor or contractor to do the service. To me, a vendor is someone who's actually providing the direct services to the client or the families or whoever receives the services. A subrecipient could be an intermediary that goes on from there. In the audit world, in the technical terms, a subrecipient is actually the awardee is the state, and then a subrecipient is anybody below that that starts getting disbursements from the state. And so from an audit perspective, a subrecipient is either an intermediary or a contractor or vendor, but anybody below that. But they you know, and sometimes some auditors, when you talk with them about 2 CFR 200, they will even see that you know, that the state is a subrecipient, but usually subrecipients are seen below you know, the person below who's actually receiving the federal funds directly.
And the subrecipient is the one who would be considered the person whom the records would be reviewed by the state agency. The state would have to review their records rather than the vendor. Mm-hmm. And that would distinguish a vendor versus a subrecipient. But the subrecipient would also be in compliance with all the block grants, fiscal and programmatic requirements. So the state would be monitoring that subrecipient is in compliance with those requirements.
Right.
And it would say so in the contracts.
Yeah, that's an excellent point, that people oftentimes think, well, you know, it just the requirements stop at the state level. No, they go to the state, the subrecipient has to also be in compliance with those same requirements.
And the state must make sure that they make that clear to the subrecipient.
Right. Yeah, and that oftentimes within when working with various states, one of the things that's important is the fiscal, especially the audit requirements, but also what you can and cannot spend the money for and stuff, is that you have to be conveying that to the state must convey that down to those people that are subrecipients, and you must convey that information. You must monitor that they are in fact complying with that, and then you have to then, you know, assure that they are in fact following those compliance, those audit requirements and those fiscal requirements. And oftentimes people forget, or they don't, I don't know if they forget, but they have the conveyance there, but sometimes it's not very clear, or it's not concise, or it's scattered throughout various documents. And so it behooves providers and intermediaries and states to look at how do they convey the material. Is it clear? And like you mentioned, is it in a contract? You know, I can't reinforce enough that when you get into fiscal issues and audit issues and those kinds of things, you know, if you didn't write it down, you may have issues. So, you know, if there are fiscal things that they cannot spend the money, or they have to spend the money during certain periods of time, those kinds of things, you really should convey that down every level so that everybody's clear and in agreement about what are the fiscal requirements for using this money, spending this money, and what it's paying for.
Okay. Next question, restrictions on expenditures. States unable to provide inpatient hospital services except under conditions outlined in regulations. What are examples?
Well, we came kind of a little bit prepared for that question because we had that question before. Programs can't expend the block grant funds to provide inpatient hospital except in cases when each of the following conditions are met. And this is directly out of the regulations. The individual cannot be effectively treated in a community-based, non-hospital or residential program, so they have to be able to meet that condition. They have and that the daily rate for payment provided to the hospital for providing such services does not exceed the state's comparable daily rate for community-based non-hospital residential treatment. So those are the conditions that are in the statutes about when block grant money can be used for that hospital, inpatient hospital services.
All right. Next question. With the limit on salaries, does this apply when paying a rate per unit of service performed and the professional performing the work is paid more than the threshold? Example, a psychiatrist providing outpatient.
The regulations are not, okay. They don't differentiate anything other than it says in terms of level 1 for federal senior executive pay level schedules, so they cannot pay a salary in excess of that level. That's what the regulations state. So it doesn't say, well, except for a psychiatrist or except for the, there's no, it just says that you cannot use SABG funds to pay anybody that salary level above that.
So the suggestion would be to use those state general funds or some other funds to pay that particular salary or add to that particular salary.
Yep. Thank you.
And that's all the questions we've received so far.
Okay, let me go back. Go ahead.
Just to let everybody know, I will be sharing the slides and the recording tomorrow. So I'll be sending a link with a password and it'll be there.
Okay. Okay, are there any other questions from either, any of the providers or the state or anything with regards to any portion of either what I presented or anything that maybe you have questions about that I left out?
And we can give folks like a couple minutes to see if any questions come in.
Yeah, I know I kind of rambled through it quick. As we wait and see if somebody has questions, I guess the key to me, because I've been doing either SABG programs of fiscal management or mental health block grant fiscal management now for about 25 years. I can tell you that there are some good pointers for people that I want to give you that I've learned from my own struggles over the years. And that's that, one, make sure, you got to be able to track all the information and segregate out your costs and know what those costs represent, both by time frames, dollar amounts, and what federal block grant you're billing them to, and in how you are accounting for those. You have to be able to account for those. You have to be able to, the thing also is, I can't emphasize enough that when you run those reports, save them. Put them in an archive. Put them electronically in an archive, put them in a folder, put them somewhere, keep them organized, because I can tell you, you may want to look up something, somebody comes in and they question that you have the core reviews, they come back, they want something from 4, 5, 6 years ago. You have to be able to either A, recreate that report, or in my suggestion, you have to be able to go back to that folder and pull that out. So you have ready access either for the SPOs or for the core reviewers or for somebody that you have those fiscal records at your disposal. and that you're able to support the numbers that you sent in. It's hard for me sometimes to say, well, what was the number I sent 5 years ago on HIV expending? I mean, so I have to, you know, I don't remember that kind of stuff from 5, 6 years ago, so I have to go back, get the reports, and look them up, and then, you know, reconcile with the, you know, the questions that are being asked, because it will come up. You will be asked for stuff, especially, you know, since you have up to 2 years to expend. You know, you got, you know, there's within a certain given period, the local agency, but also the state, may be spending money in it or have it in a contract, a state fiscal year contract. You may have 3 federal years within the award. You may have one that's ending from 2 years ago. You may have one that you just started last year, and you have money still in there now for this year, for the current state fiscal year, and you have a new one that's starting in October. So you could possibly, and you have to keep all that stuff segregated, and you have to keep it clear, and you have to keep it in reports that you can go back and reconcile both your contracts, your payments, and your spending to, and so that you're able to answer any questions that might come up. And I've found that being able, I mean, having to save that stuff is critical.
Okay, it looks like we don't have any more questions. So, like I said, I will be sharing the slides along with the recording through a link tomorrow. So look out for an email from me. And thank you so much, Rick.
Okay. Well, thank you all. If anybody has any other questions or something, go ahead and send them to JBS, and they'll pass them on to me, and we'll do our best to get an answer from CSAT, or if we can answer directly, we will. Thank you all.
Thank you.
Thank you.